My name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk And action. Hey everyone, it's Dr. Rick. Suzanne had a question about fasting mimicking diet. Now, I'm going to do a summary. I've done summaries before with regards to the FMD or fasting mimicking diet, which is also known as the 5-day fast. I've done other videos on just fasting, but if this is the first time you're finding me, don't forget to hit the subscribe button down below, because I plan on getting my subscribers and my patients to hopefully take advantage of a discount with regards to PROLON. And we'll get to that in a second. And hit the alert button to find out when I do new videos. I really think that this is going to change the dynamic of weight loss and disease manifestation, just because of the great research that Walter Longo did with regards to fasting mimicking diet and coming up with this. I've seen other people online ridicule Dr. Longo because it sounds like they're selling a very expensive box that you have to eat, but again, the data points to positives with regards to cancer. It was initially for that. See if you can give cancer patients a better survival or an alternative to medicines. And that's why dieting usually is part and parcel of what you're supposed to do every day. Activities, nutrition, sleep, love. But when you can manipulate the nutrition or the diet that you practice to be just as powerful as a prescription medicine, stem cell regenerator, diabetes, insulin or cholesterol lower, to hopefully just not only change the metrics that you get your doctor tests every couple months, but also to change the outcome in a couple 10 years. I mean, this is great. So this is why his studies are so overpowered. There are studies that are underpowered and sometimes just come out with poor conclusions. This is backed up by about 20 years of research. And I think that what's important is also to understand why he came about with this, because he runs there's this longevity clinic in California that he runs, and he took over from somebody that used to do a lot of fasting. So there were people back about 20 to 30 years ago that tried to see if you decreased total calories per day or went on a total water fast, if the outcome would be helpful as regards to reversing disease. And this is Susan. Susan had a question, where is it? Health benefits. Or, no, that's number one. Can you just drink water for 5 days? So if Suzanne tried to do that, if everybody just tried to do a 5-day water fast, it's doable. The problem is the 5-day water fast is wrought with two big deals. Well, actually one, gallstones. And gallstones doesn't sound like it's an immediate threat, but it is a surgical intervention, and rehab or recovery time is about 3 to 4 months. So even if it's just done with a scope, it's still an issue. And then when you get it out, you're going to have problems with digestion and what's called dumping syndrome. So 5-day fasts or 5-day water fasts, if you're not on medicines and if you're healthy and if you don't have any medical diseases, can give you some good results, but there are some risks. With regards to fasting mimicking diet and the protocols set forth by Dr. Longo and the use of the PROLON box, no downside. So, well, I guess there is a downside, it's price. But hopefully, again, I'll be able to chop away and give you a benefit or pass on the benefit as far as cost savings to my patients and subscribers. So can you do just water fast? You can, but it's not suggested because of that one issue, gallstones. Can you do water fasts if you're on medicines? Absolutely not. You have to get approved by your doctor first. If you're a diabetic and you're taking insulin or glyburide and you decide to go on a water fast only, you can bottom out with regards to glucose, insulin, and that leads to coma. It's probably not going to get to that point, but it can cause problems. If you're taking medicines for IBS, Lialda, if you're taking water pills, you can change around the dynamics of what happens in every cell in your body, and the fluid shifts could be a problem. Dehydration is there, so you have to be guided properly. So I would say, and just a water fast where you don't eat anything at all, that is tough. I mean, some people who practice religious fasts, they have a window where they don't eat or drink in some cases, but then they have a window where they refuel again. And I think that's safe. And religious fasts have been done for centuries with no bad outcomes. So I think total water fast, I wouldn't suggest it. Can he get the same benefits? Most likely. Again, that's where his research blossomed from. But doing that over and over again, you're going to have a problem. Doing the fasting mimicking diet over and over again, no, it's suggested if you have medical disease, you might, or if you have cancer, you might want to do it every month. 5 days, once a month for, usually it's first 3 months. And that'll bring me to the number 5 questions Suzanne had. Do you maintain a stable weight or during the remaining 3 weeks after the first week where you're doing the fasting mimicking diet? Can you continue to lose and reduce calorie? Yes. Nutrition can be manipulated outside the fasting mimicking diet. So the idea with triggering a starvation effect to your body and brain is that during the 5 days, it senses your body, your cells, your DNA, your white blood cells, or precancer cells. They sense impending doom, starvation, hostile environment. So what usually happens is that the cells that are on the verge of death, they get pushed over. And the 5-day fast is awesome because all the riffraff cells, those senescent cells, those precancers, those autoimmune cells that are just working the wrong way, Hashimoto's, Crohn's disease, psoriasis, skin or joint, they're just working the wrong way. They're not getting the right programming to turn off and revert back to normal. So the 5-day fast sets a trigger that usually pushes them into autophagy or apoptosis, whichever one you want to follow. That's when it's a programmed cell death. So sometimes those cells, especially cancer cells, don't understand or get around the programmed cell death and they keep on regenerating, which is really bad. So it leads to cancer or autoimmune disease, like I mentioned, and the manifestations of those diseases. So if you tell those cells, die, then they do. And the cool thing is, during the time that they are dying, there's also stem cells regenerating. So these stem cells, that's where I did a video on my response here. The stem cells get to different places to reproduce the organs and or tissues that were previously not working right, whether it's bone marrow, muscle cell, liver cell, adrenals, ovaries, skin. The white blood cells from the bone marrow especially can be reprogrammed. My personal story was that I went to do this to give Pat, one of my patients, an assist, because I didn't want her to do it alone, and she was tired of just not getting what she wanted out of nutrition and exercise and mindful practice. So I just said I'd do it. And I was just going to do it for support, but I did not believe the response. My muscle responsiveness, and I talk about it in my other video, is out. It's almost like I'm 20 again. I'm going to be 57 this year, in a few weeks. So, you know, it's an N of 1, so you can't, by anecdotal studies, you can't really say, oh, that means everybody's going to have the same thing, but I believe that my myosatellite cells were being turned on, and that's why my muscles are responding to the same exercise I've been doing for the last couple of years, decades. So I think it is empowering. Now, my patients that I'm doing it with, they say it's empowering. I have one patient and one associate that have been injured. Usually what happens when you get injured, you gain weight because you're not active. And they didn't gain any weight. They did this and their injuries are turning around very fast. So I think I have multiple anecdotal stories of patients that have had benefit, and usually it's in the form of reversal, the beginning of reversal disease. Let's just say symptoms. It's a little bit too soon. I just started embarking on this since the spring, but I anticipate that you'll be able to see the benefits. And that'll bring me to number 4. What health benefits will I experience and how long before I start seeing results? Most patients will see results first in the form of weight loss. Obviously, if you fast, if you cut down your total calories per day, you're going to lose weight because the fuel going in, number 1, is mindfully picked, chosen, and number 2, it's decreased compared to what most Americans eat anyway. I usually maintain about a 1,500 calorie a day diet. I've been doing it for a long time. Now it's pure plant-based, and I think that's great. I did it for a patient of mine. Before that, I was pescatarian, And I felt better. I didn't really see any changes in the markers of my blood test or my waistline or my body mass index or my muscle responsiveness. And then I sprinkle this in, and I tell you, it just triggered like an explosion to occur, so that everything I was doing before is suddenly working great. So I think that you should see effective weight loss initially. You also should see right after, when you start to refeed during the 6th to the 16th day. That's what I came up with. 5 days of fast, just like the protocol, and then the 6th to the 16th day, refeeding really important fuel sources, mostly plant-based. If you're not vegetarian, that's okay, but try to keep it very clean. No crappy stuff, decrease the alcohol, don't do the sugars, and work with protein. But I think that the one thing that I've noticed, and other patients have noticed, the urge to binge might be there on the 6th day, but the urge to continue binging and have a desire for bad foods is decreased. I've noticed that with a couple of, again, it's anecdotal, but I've noticed it in Longo's description of what usually happens. It's easier to maintain the mindful practice after the 5 days. So if you have a sugar addiction, I think this resets your taste buds, your sense of why you need the crappy food or the addictive food that you're trying to avoid, and it makes it easier to get off. Now, cigarettes, totally different story. Alcohol, totally different story. I think there's more involved with that, very complex, but at least it helps with satiety, I believe. So, and I also, again, personal story, I forgot what I had as far as, no, it was a nut butter. I picked out a nut butter, and I like nut butter for a pick-me-up with fat and low sugar. But I picked up one that had 1 gram of sugar and about 16 grams of fat. And that's not, you shouldn't be tasting the sugar. I think, to me, 1 gram is negligible. But when I ate that nut butter, I could taste the sugar. I had a heightened sense of sugar, and I didn't like it. That, in addition to other foods, I usually like to have, I don't like having chips in the house because I can't stop eating the chips. I've been able to put the chips away and just walk past the bag more than usual. Now, I'm sure there's user bias there because I'm now waiting for the next 5 days to see how well I can drop my waistline, cut the fat out, increase muscle mass. So perhaps I am anticipating that, so I'm staying on track and focused. So that is a little bit of a bias. However, I don't care because it's helping me. So if this is the way that you are going to get health benefits initially, decrease binging, decrease hunting for food, decrease cravings, maybe a little smaller waistline, cool, I'd embrace that. Now, what's going to happen, at least as far as blood tests, I'll put a link down below for the blood tests that I did. You should see a decrease in your hemoglobin A1C. That's the diabetes blood test. You take that every 3 months. You should see a decrease in lipids, cholesterol, LDL, triglycerides, maybe an improvement in HDL. That will take 6 months, I believe, because usually with my patients, when I check blood markers to see if their nutrition change has worked, and this was before the fasting mimicking diet, I would check blood markers as far as inflammation, CRP, glucose, maybe thyroid, and I would just wait on the cholesterol because that usually is 6 to 9 months before I see that respond. But it usually responds if my patients can stay focused and on track. So I think you will see a downside later on down. So you'll see immediates as far as physicality and cravings. You'll see moderate, about 3 months, you'll see some blood tests decrease, some markers of inflammation decrease. I think the worse you are with disease process, the better you'll see the response. If you're in your 30s, you're healthy, you have a BMI that's 23 or below, you exercise, and you eat pretty clean, you're probably not going to notice as many abnormal blood tests initially. But if you do the blood test that Longo tests out for, and it's in my video too, IGF-1, CRP, lipid profile, a couple other things, you might see some changes. I was able to see changes in my thyroid and my beta-hydroxybutyrate. So you can check out my video. And then the upside too, further down the line, you should see reversal of bigger diseases. So, and then what happens is you dovetail into the next FMD. So I think you'll see benefits right after. You'll feel benefits right after. You'll see benefits in a few months, and you'll see benefits down the line if you maintain it. And Suzanne is awesome. She's done great things already. She's on fire, so why not do this? I had one of my doctor friends ask me, I'm already fit, what am I trying to do? Because I shot a picture of my abdomen. I haven't had a six-pack in a long time, at least a well-defined six-pack, and it came back. And he said, what are you trying to do? You're already fit. And you know what? If I'm trying to, and this is I didn't respond, but my answer is that if we make a categorical change in our disease process, does that mean we have to be content and stay with it? No, I would always strive for the next level or the next category. If I'm going to be 60 and I have controlled cholesterol, I've watched my BMI, I've lowered hemoglobin A1C, and that's cool, but I still at 60 have those diseases of the decade that I have to worry about. Heart attack, brain, stroke, Alzheimer's disease, and cancer. So why wait? I'm not saying I have to be perfect to get into that decade, but I want to at least say if I get those diseases, I did what I could. So I think we always should strive for the next category of health. So drop down from severe medical disease to moderate medical disease, to mild medical disease, to pre-disease process, to normal, to better than normal. So that's what I would hope for most of my patients, and everybody has their own journey. So. And finally, what is the best book? Not finally, but I'd say read this and then get on the blogs on Facebook or online. Facebook, it's Fascination. Pretty good. You can see other people going through the round 1, round 2, round 3, first day, second day, fifth day. It's kind of cool. You can see how you can learn from other people's mistakes or their feelings when they're going through it, how to navigate your responsiveness. But if you must eat, do you have to eat the prepackaged foods? This is probably the most important. This is the prepackaged foods. PROLON. This box is expensive, and I'm hoping to offer this to my patients. I'm trying to get El Nutra to make me a distributor and hopefully give it. I can't give it to everybody, but I give it to my patients and my subscribers. And I did a video on this too, so check it out. Pretty good. I think they did a lot of research, and it's well packaged, easy to go through. I mean, day 1, all you have to do is open the box and you start taking these things. So it's you spread it out throughout the day. I think if you're desiring coffee, you can have coffee. That's about it. There's also nice balance chart on what's in each product. So you do have to be good with reading labels. Because if you don't read labels, you're going to be guessing. Just FYI, this is the shortcut. So that's what you're going to be experiencing as far as the box. If you wanted to, and there's the drink, ideas about the drink, the glycine. So if you wanted to, you can probably shortcut this. But the shortcut, it's not suggested to make your own foods. But if you're going to make your own foods and dial it in, you have to be good with understanding of what a cup is, because if you're going to do and reading labels. So I just did a video on protein. This is my plant protein. You have to be able to read and interpret this, and most importantly is that 180 calories, because on the first day you're supposed to take about 1,000 calories. On the second to the 5th day, 750 calories. So if you just do this and stick to plant, it has to be plant. You can't have animal products in there because I think it might change the formula. But I'd say calculate and spread it out. Keep it mostly to plant and calculate and spread out. Know your calories. I guess you have to know your macronutrients. This is water, sparkling water, no calories. Shouldn't affect. But so for example, if you're going to have romaine lettuce, you have to know how much volume your plate. Measure the volume of your usual plate. You have to know what your calorie content is as far as your dressing, how much dressing you use. You have to know your fixins. So these are the little things that I put, so you have to be able to read those. 40 as far as croutons, 20, 30, 25, 35. And it says 2 tablespoons too. 2 tablespoons is equal to 35, so you can't exceed that, or you have to take that into account. 1 tablespoon is equal to 40 calories. If you choose to just have snacks, like walnuts, you'll have to look up how many walnuts is in a 1/4 cup and then pre-measure it out. So you'll have to use a reference. as far as knowing how much volume is, how many calories and what kind of macronutrients are in a volume of something, whether it's nuts, legumes, beans. This is my old pescatarian stuff. I used to love these things. I still do, but I choose not to do it. So if you do this, luckily, you have, again, a label on the back. This is, whoops, this is upside down. So in one serving size, one can, you have 230 calories. I don't know if you could see that. 230 calories in one, so that's a nice snapshot. You have to learn to read these labels. This was kind of cool. I found this at Fruitful Yield. Really yummy because it adds a little bit of pasta, a little bit of rice, and the calorie content's not too bad. So this is 3 servings, but it's 293 calories per serving. This is 225 calories per serving. I just cook this up and divide it into 3, and that'll be 200 times 3. So again, if you're doing the 2nd to the 5th days, 200 times 3, 246, you're almost finished your total calories per day. So if you just do this packet in one day and spread it out, you might be okay. You won't starve to death. That's it. Again, this is my tofurkey. I love this stuff as far as tofu, organic, and again, calorie response. You have to see, because this is a lot of protein, and that's why I wanted to bring this up. This and this would be a ton of protein. And I think that what Longo's information came up with was that sugar and protein cause an increase in mTOR and pKa. So those are 2 pathways that get stimulated that lead down the road of screwing up your growth hormone, IGF-1, turning on cancer. So you want to keep those levels down. I think you want to get into a level of ketosis too. That's what usually starvation ketosis results in, without starving too much. So, which brings a good point. I tried to exercise my first round. First round I did just with whole foods. I wanted to see what it was like. Second round I did with the box. The box kicked my ass. It was really tough. And it shows in my blood tests. Check out my video and you'll see. The blood tests were good with the fat whole food approach. So Suzanne, Whole Foods. The blood tests were good with whole foods and I did feel an effect. But they were better with the PROLON box. So I guess the investment is, do you do the box? It depends on your talents as far as calculating stuff. So if you're no fuss, no muss, you just want to get pre-packaged, do the PROLON. Hopefully you'll be able to find a pretty decent price. If you can't afford that, or if you're on a budget, do your own, but you're gonna have to do research as far as a plant-based, low-calorie, high-value food group design on the first day, which is 1,000 calories spread out, and on the 2nd to the 5th days, which is about 750 calories spread out. Most important too is on the 6th day, when everybody has the urge to binge, don't binge, because your stem cells are being fed during the 6th to the 10th day. That's as far as I could read in Longo's book. I think that after the 10th day, or I should say 16th day, 6th to the 16th day of your program, you have to eat clean. You can also start exercising again. I was saying that I exercised the first round. I hit the wall on the 3rd day. I exercised the 2nd round a little bit, and I said, no way. I was hitting the wall just because the box is so tight as far as the liquids, the soups, and it tastes pretty good. In fact, they offer more soup varieties now, so they're getting better. And the box that you pay for, the price you pay for the box, is going back into more studies as far as Alzheimer's disease, multiple sclerosis, diabetes, athletic responsiveness in young people. So I think we are getting benefits. We're also supporting a worthy cause to get more information, to fine tune and dial in even more data. Some people will do a 3-day, some people do a 7-day. So again, the information is only on a 5-day, and the information is only on using the box. But depends on, so the last question, depends on what your goals are. If your goals are just to lose weight, I think doing the whole food approach would be fine. If your goals are to reverse disease or fight cancer, I would stick to the box. So hopefully this, Suzanne, hopefully this gives you a nice idea about what you should try. And everybody, Suzanne's on fire already, but if she wanted to just add a couple more things to prepare and push Father Time back even further, I'd say do it and see how you respond. But I would do 3 rounds. If you're just experimenting and you're healthy, try 3 rounds and see what happens. I think Longo suggests if you're very healthy, once to twice a year should be fine. If you have disease, every month would be okay, as long as you can afford it. So if you have anybody else that does the PROLON or the fasting mimicking whole food approach, please put your comments down below on how you responded. Otherwise, don't forget to subscribe and hit the alert button. I'll see you at the next Minute Clinic.